Hello, listeners! Hello, world! For today's topic, we are going to talk about ECCD, Early Childhood Care Development. Early childhood care education, according to the UNICEF, every child deserves access to quality early childhood education. Quality pre-primary education is the foundation of a child's journey. Every stage of education that follows relies on its success. Yet, despite the proven and lifelong benefits, more than 175 million children, nearly half of all pre-primary age children globally, are not enrolled in pre-primary education. Children enrolled in at least 1 year of pre-primary education are more likely to develop the critical skill they need to succeed in school and less likely to repeat grades or drop out. As adults, they contribute to peaceful societies and prosperous economies. Evidence of the ways in which pre-primary education advances development exists around the world. Yet, global disparities in enrollment persist. More than half of low and lower middle income countries are not on track to ensure at least 1 year of quality pre-primary education for every child by 2030 as set out by the Sustainable Development Goals. The international laws on early childhood care and education, ECCD programs and services in the Philippines are not new. Health, nutrition, early education, and psychosocial care, parenting and education, and other social services for children ages 0 to 6 and their families have been the government's concern instituted in its various line departments. What is new and promising is the promulgation of a national ECCD policies framework that provides, among others, the institutional structures at all levels to implement the national ECCD policy. The ECCD law is a very significant policy step to provide the mechanism to integrate and harmonize multi-sectoral ECCD initiatives. This paper presents an overview of the current state of ECCD governance, particularly at the national level. The 2007 population census reported an enumeration of 88.57 million Filipinos by NSO 2008. About 46% are children below 18 years old. The 0 to 6 years of age represent about 18% of total population. In 2000, the population of children 0 to 6 years old was 13.5 million. By 2010, the number is projected to increase to 17.2 million or 3.6 million more than children 0 to 6 than in 2000 by NSO. In this age group indicates a high dependency ratio and would entail significant additional resources needed to provide basic needs such as food, healthcare, and education. A major poverty intervention program in the country to guarantee child rights and ensure child well-being and development is ECCD. The implementation of ECCD in the country is governed by the Republic Act No. 8980 Footnote 1 or the ECCD Act of 2000. According to the legal frameworks of governance of early childhood care and development, two major laws are cited because of its implication on the status of ECCD governments in the country. These are the Child and Youth Welfare Code of 1974, which codified the rights and duties of children, the duties and responsibilities of parents, the community, and various stakeholders in promoting the welfare of the Filipino children and youth 0 to 21, and created the Council for the Welfare of Children or the CWC as the national coordinating body on children and youth concerns, and the Local Government Code of 1991 that provided for a more accountable local government structure instituted through a system of decentralization and mandated the devotion of basic services to the local government unit, particularly health and social welfare. A brief description of the ECCD Act follows. And lastly, ECCD, the Early Childhood Care and Development Council, is a government agency mandated by Republic Act 10410 or the Early Years Act of 2013 to act as the primary agency supporting the government ECCD programs that covers health, nutrition, early education, and social services for children aged 0 to 4 years. It is responsible in developing policies and programs, providing technical assistance and support to ECCD service providers, and monitoring ECCD services, benefits, and outcome. The training programs, the ECCD Council has established mechanism for the systematic professionalization of ECCD service providers through its Human Resources Development or the HRD programs. They are also equipped with suitable knowledge, skills, and values with regard to early childhood care and education for children aged 0 to 4 and parenting mentoring. The National Child Development Center is the flagship program of the Council and it's the centerpiece of all its ECCD initiatives. It is a child-friendly facility that serves as the first school of children 0 to 4 years old in the barangay. And it envisioned to attain the goal of expanding the access to quality early childhood care and development. The advocacy, information, and communication. The ECCD Council has different kinds of advocacy and social mobilization, or the ASM, activities that are designed to generate awareness, interest, and understanding on early childhood care and development. A web-based information system used by the ECCD Council and its partner LGUs to monitor and track the operation of NCDCs, including its ECCD service delivery across the country. It contains the database of ECCD data within the LGU, including but not limited to children age 0 to 4, their families and their respective communities. Children Development Center or the CDCs and Child Development Teachers or Workers or the CDT or WS. The system features an automated ECCD checklist to track the holistic development of children enrolled in the NCDC.